Sierra Leone has been plagued from Ebola to COVID and now Mpox.
The Nelson Mandela Hall at Doha's Hotel in Bo was full of bright smiles and renewed hopes this weekend as Sierra Leone took another bold step towards protecting its children and communities through immunization. For 3 days, health experts, policymakers, and development partners gathered to review and validate the country's national immunization policy. The workshop was organized with strong support from the Mastercard Foundation, Africa CDC, and Amref, under the Saving Lives and Livelihoods project implemented by Focus 1000, working alongside the Ministry of Health's expanded program on immunization.
Focus 1000, through the support of its partners, Mastercard, African CDC, Amref, thought it fit that the process of developing an approach to solve the immunization issue in the country will not be complete if the COVID-19 vaccination process is not integrated into the immunization policy. It is with this commitment that we have gathered this meeting here today to look at how, together with the government, we can provide the needed support to put this workshop together to look at critical issues in regards to these policies and how we can improve upon the policies and how we can develop the implementation plan around these policies and how we can get the needed stakeholders to buy in support in implementing the things that we have agreed together in this workshop.
The goal of the review process is simple but powerful: to integrate COVID-19 vaccination into routine immunization in Sierra Leone, making sure every child, family, and community stays safe from vaccine-preventable diseases.
I'm here today on behalf of the Committee on Health in Parliament, especially the chairperson. I want to start by sincerely extending my heartfelt appreciation to the Ministry of Health, its technical and development partners, especially Focus 1000, for organizing this important workshop. The 3 days engagement marks a critical step in reviewing our national immunization policy, which was originally endorsed by Parliament in 2023. This review is a process that demonstrates our shared commitment to keeping health policies responsive, inclusive, and aligned with global best practices.
This policy document is very important and very key. And also the vision. We like to thank you because the vision of this policy document, the provision and accessible vaccine for all, is also in line with the African Union call that vaccination or immunization for all is immunally possible. That is very possible to vaccinate all. So we really want to thank you. We really continue. Africa CDC will continue technically supporting the Ministry of Health and also the EPA. Thank you.
Immunization policy development and validation ensures the expanded program on immunization effectively delivers its goals of reducing diseases and strengthening healthcare by aligning with national strategies and global immunization goals, and also by regularly assessing and updating strategies based on performance data.
So as a Ministry of Health, we are very much happy because this document is going to address our health policy that this country has stipulated. And it's also going to support us in our drive to reduce the needless deaths among children and all other categories. And if you look at this document, it is going to address the current trajectory in the ministry, that is the life stages approach, because we even consider the elderly in terms of vulnerability and beneficiaries among the immunization program.
As the doors of Nelson Mandela Hall closed on the final day, participants left with renewed commitment to take the policy forward and ensure it brings lasting change. With policies like this taking shape, Sierra Leone moves closer to a future where every child is protected and every community is healthier and stronger.